Happy New Year, everyone. It's my great pleasure to be here and present this topic on integrated diagnostic imaging for retinal disease management. These are my financial disclosures. So I'd like to start with this case study of a patient that we see every day in the clinics of an elderly a female with neovascular AMD who consulted with us with a visual acuity of 20/50. We treated her over the next 2 years with 8 intravitreal aflibercept injections, resulting in her visual acuity improving to 20/30. And every time we tapered off her injections, the swelling came back and her vision started to fail. But at this point, after 2 years, she started to complain of injection fatigue. I'm tired of getting injections every 2 or 3 months. So she wants to have her injections every 6 months. Is this a good idea? So over the next few minutes, we'll be illustrating how the ZEISS Forum and Retina Workplace can help us work through these problems that we see every clinic day. So for this patient, is increasing the interval between injections a good idea? How do we find the answer to this? One way, this is a way that a lot of doctors do, is they go into the ZEISS Forum, they pull up all of the images, angiographic and OCT images over time, and then they review these images to find out how the patient has responded to treatment and whether we can increase the treatment interval. But this sequential review of images on the ZEISS Forum may take considerable time, and we may have to stop the clinic to review these images to come up with a recommendation. Also, showing these images to somebody with suboptimal vision may be difficult for them to understand what's happening to their eyes. And if we show them numbers such as central retinal thickness, they may not be able to understand it as well. So what we need is a way to view all of the serial examinations in one screen, see the important information readily, integrate the results from multiple imaging modalities, and very importantly, to be able to present that data in an easy to understand way to our patients. This is where the ZEISS Forum and Retina Workplace comes in. These are imaging data and integration software, which makes our life easier. What types of images can be placed into the Forum and Retina Workplace? We can get data from the different ZEISS fundus cameras, as well as the ZEISS OCT machines. And we can also import some data from third-party fundus cameras. So when we import all these data, we can put together all this data to allow us to have multimodal imaging analysis. And you'll see later how this is a very powerful tool to help us manage our patients. One thing we like about the Retina Workplace is that it's very easy to transition from the Forum to the Retina Workplace. It's basically one click on a bar in the Forum page, and you'll be brought to the Retina Workplace. So the Retina Workplace allows us to perform different kinds of review functions. We'll be able to review the patient's information as they evolve over time. So we can bring in images from our fluorescein angiography machine, from our fundus camera and OCT machines, put them all on one screen, and this gives us a very powerful way of understanding the patient's situation. Very important also is to be able to see these changes over time. So as you can see from this picture, as the patient comes in for different visits and gets treatments, their images change, and these images are very easy to demonstrate to the patients and give the patients an understanding of how they're doing. We can also input into the Retina Workplace the different types of treatments that we give our patients, whether it's injections or laser treatment. And these are inputted at different time points. By doing this, it will be very easy to correlate treatments with treatment outcomes. We will demonstrate that later on with some case presentations. The Retina Workplace also allows us to visualize different data formats. So sometimes we may want to look at tabulated data. And there are some situations where we like to look at the ETDRS maps. We can also pull together some videos so we can synchronize images from different time points, and we can scroll through the OCT scans and angiographic scans, and this will show us simultaneously how the retina behaves at each different point. We can also present data in graphic format, and we find this to be a very powerful tool to help both doctors and patients understand the effect of treatment outcomes. The Retina Workplace also gives us a lot of measurement functions. So this patient with full thickness macular hole came in over several years, and we are able to use the Retina Workplace to measure the diameter of this macular hole and demonstrate to this patient that over time, her macular hole was increasing in size, and this was correlated to a decrease in her visual acuity. So this ability to generate linear measurements and demonstrate this to the patient helps them to understand their disease better, and helps them to make better informed decisions as to treatments. Another powerful tool is the ability to make area measurements. So here you can see on the top half of this image, we can do area analysis of a pigment epithelial detachment. And on the bottom side, we can measure cross-sectionally that same pigment epithelial detachment. And after treatment with anti-VEGF medications, you can demonstrate to patients both in terms of an aerial view as well as a cross-sectional view that their lesion has responded. And this encourages the patients to continue with their treatment because they understand that they're getting better. Another powerful feature of the Retina Workplace is the ability to do treatment planning, like for photodynamic therapy. So how we do this is we can use the measurement software to measure the greatest linear diameter, and then we can use the same software to add 1 millimeter to this greatest linear diameter, and then we can create a treatment circle that corresponds to that greatest linear diameter plus 1 meter, superimpose this on the image, and use this to perform the photodynamic treatment. Now we'd like to show some very interesting presentations that illustrate the usefulness of the ZEISS Forum and Retina Workplace in everyday management of cases. So let's go back to our first case of the 82-year-old grandmother who was getting tired of getting her aflibercept treatments and wanted to be injected every 6 months. What is the optimal injection frequency for this patient? So we showed her and her daughters the graphic analysis of her response to her anti-VEGF treatments. And you can see here on the first few months when we were injecting her monthly, the retina was very dry. The yellow line here shows you the central retinal thickness. And as you can see, it was dry in the first few months with every monthly treatment. But later on, we tried to do treat and extend. And as you can see, when we shifted to every 2 to 3 month dosing, we can see that the edema would sometimes break through. And with each repeated treatment, the edema would decrease. So even though her visual acuity remained the same, you can see that extending the treatment intervals initially led to recurrence of edema. But over a later period of time, as we persisted with the every 3 months treatment, you can see that the amount of edema actually started to decrease and remained low. So we told her that, you know, maybe the most we can do in this case is to inject you every 3 months. And if we were to extend past 3 months, you would probably lose the visual acuity that you gained. And then you'd probably have to wind up going back to an every monthly injection. So she then agreed to every 3 months injection. So this graphic analysis shows you the power of the Retina Workplace in helping to educate patients with how their eyes respond to treatment and what's the optimal treatment schedule for them. This is another case of a 69-year-old female executive with retinal vein occlusion. And because she's very busy and traveling, she wanted fewer injections. So when she first came in, we gave her aflibercept injections every 2 months. And this led to drying of her macular edema and improvement in her visual acuity. She went back to 2020. Um, and as we tried to increase the interval, though, you can see that the retinal edema started to come back and her visual acuity started to deteriorate. And because she wanted fewer shots, we shifted her to Ozurdex. And you can see here the very nice response of her eye to Ozurdex, going 4 months with a single injection without recurrence of edema and stable visual acuity. So she's probably received about a year's worth of Ozurdex now. She's pseudophakic and she's very happy with the results. So again, this type of graphic display shown to the patient helps them understand how their eyes are responding to treatment and helps them better choose what's the best dosing strategy or treatment for them. Here's a patient, 65-year-old male with polypoidal choroidal vasculopathy. And in this patient, we performed a treat and extend dosing strategy. So the yellow line is the central retinal thickness. And as you can see, at the start, we gave the anti-VEGF injections fairly frequently, and this dried up the retina. You can see the central retinal thickness go down. This visual acuity improved, and as we went into the treat and extend strategy, we can see that for the most part this worked. But when we extended the treatment to roughly 3 months, some of the edema started to come back here towards on the right. So we had to bring back the patient to a more frequent injection interval, so from 3 months to 2 months. Here's a patient that's been with us for a long time. And you can see that with every 4-week anti-VEGF injection, she's done very well. Her retinal edema has been very nicely controlled. But another powerful feature of the retinal workplace is we're actually able to do measurements. So you can see here on the black and white OCT scans, we were able to measure the size of her choroidal neovascular membrane. And we added on her visual acuity. So here on the left, she had 20/40 visual acuity at the start with a lesion size of 1.4 millimeters. And as we continued on with her treatment, the choroidal neovascular membrane continued to shrink. And this was associated with an improvement in her visual acuity. So this encouraged the patient to continue with her anti-VEGF treatments. And maybe an interesting thing here down here on the graph, you can see a spike in the patient's retinal edema and macular volume. This was because of the pandemic lockdown. She was not able to come for treatments. And when she finally did came, after months of no treatment, you can see that her visual acuity decreased and the edema had increased. So case 5 is a 70-year-old patient with PCV. He had a pigment epithelial detachment, and we gave him 3 or 4 anti-VEGF injections. But as you can see here from the graph, we can measure the size of the PED. And even after anti-VEGF injections, you can see that there was no change actually in the PED diameter. So because of this, we told the patients anti-VEGF probably would not work for you. So the patient instead was shifted to photodynamic therapy. And this is the last case of a 58-year-old physician with neovascular AMD. She developed tachyphylaxis to both bevacizumab and aflibercept. So she came in with significant retinal edema and poor vision in one eye. And despite different injections with bevacizumab in red and aflibercept in blue, there didn't seem to be any response to these anti-VEGF medicines. The other eye had undergone macular atrophy from previous photodynamic therapy, so she couldn't see well out of that eye. So she didn't want any more cold laser treatment. So fortunately for her, we were able to apply and get approved for compassionate use of brolucizumab. So Novartis provided us the drug, and we were able to inject her eye with all the caveats. And fortunately for everyone, her visual acuity improved, and her retinal edema decreased, and her retina remained dry with brolucizumab treatment without any evidence of retinal or ocular inflammation. So the past few cases illustrated the power of using the Retina workplace to help educate patients and to help us optimize treatment for patients with retinal diseases. Now let's turn our attention to how the forum and the Retina workplace, this imaging data management, can impact our practices. In our practice, we use the Zeiss forum, and later we incorporated the Retina workplace in our main clinic. And we like this system because it helps us achieve faster workflow and reduce errors. So after the doctor orders up the diagnostic tests, the staff would encode these tests once. And when the patient goes to the diagnostic instrument, the request for the tests already be in that instrument. So this helps us avoid having to encode each patient's test into each diagnostic instrument. So it makes it for faster flow, and it reduces errors. We also want to show the power of this graphic analysis on doctor and patient decision making. So I'd like to use this example of buying stock shares in a company. So if I showed you the stock share of this company, Tesla, on Friday, you can see the price of this data, but it hardly makes you decide whether to buy or sell or even touch the stock. But if I showed you the graph of how the Tesla stock has performed in the past year, you can see a rapid increase in the price of Tesla stock. So this would help you decide better whether you want to buy or sell this stock. So that graphic information helps greatly with decision making. And the same is true with the Retina workplace. We can harness the power of graphic analysis to help us understand and figure out what's best for the patient. So if you just showed the patient their OCT scan at a given time point and you recommended some treatment, they can see it, but they may not be able to understand what's happening or be convinced as to what's the appropriate course of action. But if you show them a graphic analysis of their disease over time, like here on the right, you can see the different time points of injection and how the central retinal thickness went down. The patient can understand that after the injection, they do respond and their vision gets better. So this helps the patient develop confidence to continue with the treatment that you recommend. So the Zeiss Forum and Retina Workplace results in faster workflow. It gives us ready access to information to help us improve our outcomes. And because of the digital encoding of tests, this increases retinal safety. So all of these combined together leads to a nice environment to work in. And when you have a nice environment, this improves the patient experience. And we found that it greatly impacts the conversion rates. So in our practice, we had 4 clinics. In our main clinic, we had all the diagnostic equipment. We had the Zeiss Forum and the Retina workplace to analyze our data. And in this clinic, our conversion rate was 89%. So when you show the patient their information and the graphic analysis, 9 out of 10 times what you would recommend to these patients, they would do. We have a clinic in another part of town which had the diagnostic equipment as well as the Zeiss Forum, but we did not get the license for the workplace. And here our conversion rates were also not bad, but they're not as good as when you can show that graphic analysis to patients. We also have a clinic in a tertiary hospital And the policy in this tertiary hospital is you cannot have any diagnostic equipment in your own clinic, but the hospital has its eye center. So we would send patients to the diagnostic equipment in that eye center, but often they'd have to do it on another day. They'd get the test done on another day. They'd come back with the results on another day. And we had no way of showing uh, to these patients the graphic analysis of their outcomes. So in this place, our conversion rates were not as good. And we have one small satellite clinic in another center where we do not have access to any equipment, the forum or the workplace. So the patients would have to go somewhere else, get their test done, and bring the results back to you. So in this clinic, the conversion rate was dismal. So analyzing the data from these different clinics, we conclude that better access to imaging helps improve patient understanding and conversion rates. So this also translates to financial results. So in summary, the ZEISS Forum and the Retina Workplace are very powerful instruments to help us integrate multimodal imaging into our practices and help us manage our patients better. They're very easy to access. You just have to click once on the forum and you can get into the Retina Workplace. With these powerful tools, we're able to correlate the treatments we give our patients with their anatomic outcomes. We're able to better to educate patients as to how they're doing and how they respond to treatment. Also, the digital system results in a very efficient workflow for management and assessment of these macular diseases. And when we look at our financial results, we conclude that image data management is a great tool for building practice success. So thank you very much for your kind attention, and I hope you learned some insights in this short presentation.